Let me give you a little history on the birth control pill. When pills were first developed back in the 1950s, they were actually working on two pills, one for men and one for women. However, they immediately found during these tests that the male birth control pills, which prevented the male from producing sperm, had caused the male testicles to shrivel up. So they stopped the program because, as you can imagine, those pills weren't going to be popular with men. In the early trials of the birth control pills, women were dying while the male testicles were shriveling. So they reduced the amount of estrogen in the pill, which made it less risky for the woman, but at the same time made it more likely that the pill would cause abortions by preventing implantation of the embryo. While the risk of death of the woman today has been reduced, it is still very real. Now just a word about steroids. There are many different types of steroids and they're used for different things, but they generally have an anti-inflammatory effect. In medicine, it is usually good practice to prescribe steroids cautiously and sparingly. Inflammation generally resolves within hours or days. Doctors are especially cautious with injured athletes because of both the short-term and long-term effects of steroids. But with hormonal contraceptives, and specifically LARCs, there is a continuous release of synthetic steroids in the woman's body for up to 10 years. With athletes, the doctor is trying to cure an illness, but the function of hormonal contraception is to make a healthy reproductive system sick. The woman's body is continually trying to regain its equilibrium. The steroid hormones need to be continuous, lest she gets pregnant. Let's keep something in mind. Pregnancy is not a disease. A healthy body should not be subjected to medicine in order to create a diseased reproductive system. Medical intervention is rightly used to fix something broken or to heal an illness. But when a woman's body ovulates and prepares to nourish new life, it is not broken or ill and doesn't need medical intervention. In fact, ovulation is a sign of health. We talked earlier in the presentation about how wonderfully each woman is created. In each cycle, a woman's body gears up to prepare for conception to occur, and after ovulation, the body responds by preparing for possible pregnancy. However, when a woman uses a hormonal contraceptive, such as the pill or a LARC, high levels of synthetic hormones are used to disrupt the natural cycle, and as we have seen, can also have systematic effects on other areas of the body. The pill, chemically laced IUDs, shots, patches, etc., are powerful drugs used to disrupt a healthy, working reproductive system. Most women don't realize that the hormonal contraceptives taken either orally or by implant or by inserting a device inside the uterus or vagina have some serious side effects. I'll discuss these next.